Picture this. You're standing in your bathroom, looking at the 4 or 5 prescription bottles lined up on the counter. Maybe there's an over-the-counter pain reliever too. You take them faithfully every morning, trusting they're helping you. But when was the last time you really understood what each one does, or what to watch for as you get older? I'm Dr. Naira Stein, and I've practiced cardiology for over 20 years. What I've learned is that medications are powerful tools. They save lives, prevent heart attacks, manage chronic conditions, and improve quality of life in countless ways. But like any powerful tool, they need to be used thoughtfully, especially as our bodies change with age. Today, I want to walk you through how to be an informed, engaged participant in your own medication management, not to create fear about the pills you're taking, but to help you recognize when something doesn't feel right, and to give you the language to have productive conversations with your healthcare team. Stay with me, because what you learn here could help you get the most benefit from your medications while staying alert to potential problems. Let me start by saying something crucial. Most medications do exactly what they're supposed to do. They lower blood pressure that would otherwise damage your heart and kidneys. They prevent blood clots that could cause strokes. They manage diabetes, reduce pain, and treat infections. The vast majority of people taking medications benefit from them significantly. But here's what also matters. As we age, our bodies process medications differently. Our kidneys and liver work less efficiently. We tend to take multiple medications that can interact with each other. And side effects that might be mild at 50 can become more significant at 75. Understanding this doesn't mean fearing your medications, it means being an informed user of them. Let me walk you through several common medication categories and what you should know about them, especially after 60. I'm not telling you to stop taking anything. I'm giving you information to discuss with your doctor. First, let's talk about pain relievers, specifically NSAIDs like ibuprofen, naproxen, and others. These medications are remarkably effective for arthritis, back pain, headaches, and general inflammation. For many people, they make daily life manageable and comfortable. What you should know is that these medications can affect your cardiovascular system, especially with long-term use, and especially as you get older. They can cause your body to retain fluid, which makes your heart work harder. They can raise blood pressure modestly, and for people who already have heart disease, they may slightly increase the risk of cardiovascular events. Does this mean you should never take them? Absolutely not. It means you should use them thoughtfully. If you take them occasionally for a headache or sore muscles, that's generally fine for most people. The concern arises with daily, long-term use, especially at higher doses. Here's what to watch for: swelling in your ankles or legs, sudden weight gain from fluid retention, or worsening shortness of breath. These can be signs your heart is struggling with the extra fluid load. Also pay attention to your blood pressure if you monitor it at home. If it creeps up while you're taking NSAIDs regularly, that's worth mentioning to your doctor. Questions to ask your doctor. Given my heart health and blood pressure, is this the safest pain relief option for me? Are there alternatives I should consider? If I need long-term pain management, what's the best approach? Sometimes acetaminophen works just as well with different risks. Sometimes topical anti-inflammatory creams are effective for joint pain without systemic effects. Your doctor can help you find what works best for your specific situation. Next, let's discuss proton pump inhibitors, medications like omeprazole and pantoprazole that reduce stomach acid. These are among the most commonly prescribed medications in the world, and for good reason. They're excellent at treating acid reflux, healing ulcers, and protecting your stomach from damage caused by other medications. What you should know is that these medications were originally designed for short-term use, typically 4 to 8 weeks, but many people end up taking them for years, sometimes without periodic reassessment of whether they're still needed. Long-term use can affect nutrient absorption, particularly magnesium, which is important for heart rhythm. Some research has suggested possible associations with increased cardiovascular risk, though the evidence isn't definitive and the mechanisms aren't fully understood. These medications can also interact with other heart medications, potentially reducing their effectiveness. Does this mean they're dangerous? No. Many people genuinely need them and benefit from them. But if you've been taking one for months or years, it's worth having a conversation with your doctor about whether you still need it, whether the dose could be reduced, or whether lifestyle changes might help you use less medication. What to watch for: unusual fatigue, muscle cramps, or irregular heartbeat, these can sometimes signal low magnesium. If you're taking these medications long term, ask your doctor about monitoring your magnesium levels periodically. Questions to ask: do I still need this medication? Have we tried reducing the dose? Are there dietary changes that might help me need less of it? Could we monitor my magnesium levels? These aren't confrontational questions. They're collaborative ones that help optimize your treatment. Now let's talk about something you might not think of as a medication issue. Cold and allergy remedies containing decongestants like pseudoephedrine or phenylephrine. These are sold over the counter, which makes them feel safe and harmless. For many people, they are. But decongestants work by constricting blood vessels. That's how they reduce nasal swelling. The challenge is they don't just constrict blood vessels in your nose. They can affect blood vessels throughout your body, which can raise blood pressure and increase heart rate. For most healthy younger people, this isn't a problem. But if you already have high blood pressure or heart disease, especially if you're over 60, these effects can be more significant. A temporary spike in blood pressure or heart rate that wouldn't bother a healthy heart might stress one that's already working hard. Does this mean you can never take cold medicine? Not at all. It means reading labels carefully and choosing products without decongestants if you have heart issues. Saline nasal sprays, steam inhalation, and antihistamines often work well without the cardiovascular effects. And if you do take a decongestant, use it for just a few days, not weeks. What to watch for: feeling your heart racing, significant increase in blood pressure if you monitor it at home, feeling jittery or anxious. If you notice these effects, stop the medication and talk with your doctor or pharmacist about alternatives. Let's discuss antidepressants, specifically an older class called tricyclic antidepressants. These medications, like amitriptyline and nortriptyline, aren't used as commonly for depression anymore because newer medications tend to have fewer side effects. But they're still sometimes prescribed for chronic pain, particularly nerve pain. What you should know is that these medications can affect your cardiovascular system in several ways. They can cause orthostatic hypotension, a drop in blood pressure when you stand up, which increases fall risk. They can affect heart rhythm, and they can interact with other heart medications. Now, depression itself is a serious cardiovascular risk factor, so treating it is crucial. And for some types of chronic pain, these medications work when nothing else does. The point isn't that they're bad. It's that if you're taking them, especially if you're older or have heart disease, your doctor should be monitoring their effects. What to watch for: dizziness when standing up, especially in the morning. Take your time standing. Sit on the edge of the bed for a moment before walking. Also pay attention to unusual fatigue or changes in heart rhythm. Questions to ask: are there newer alternatives we could try? Should we be monitoring my blood pressure and heart rhythm? Are there strategies to reduce fall risk while I'm taking this? Your mental health and pain management are important, and so is your safety. These goals don't have to conflict. Finally, let's talk about calcium supplements. This is probably the most nuanced topic because the evidence is genuinely mixed and the situation is complex. Calcium is essential for bone health, and osteoporosis is a serious concern as we age. Getting adequate calcium is important. The question is whether high-dose calcium supplements are the best way to achieve that, or whether they might carry cardiovascular risks for some people. Some research has suggested that calcium supplements, as opposed to calcium from food, might be associated with increased cardiovascular risk in certain populations. The theory is that large doses of supplemental calcium create spikes in blood calcium levels that the body handles differently than calcium from food, which is absorbed gradually throughout the day. However, other studies haven't found this association, and for people with diagnosed osteoporosis, the bone benefits may outweigh potential cardiovascular concerns. The evidence isn't settled, which is precisely why this deserves thoughtful conversation with your doctor. What seems clear is that getting calcium from dietary sources, dairy products, leafy greens, fortified foods, is safe and effective. If you do need supplements, taking them with food and spreading the dose throughout the day rather than taking a large amount at once may be preferable. Questions to ask: do I genuinely need calcium supplements based on my bone density and dietary intake? What dose do I actually need? Should I take calcium with vitamin D for better absorption? Could I meet my needs through diet with some targeted supplementation rather than large doses? This is a decision that should factor in both your bone health and your cardiovascular risk profile. Now let me step back and talk about the bigger picture. Everything I've shared today isn't meant to scare you about medications. It's meant to help you be an informed, engaged participant in your own care. Here's what being informed looks like in practice. You know what medications you're taking and why. You understand what benefits they're providing. You're alert to potential side effects without being anxious about them. And you have regular conversations with your healthcare team about whether your medication regimen still makes sense as your health evolves. Let me share some practical strategies for managing medications wisely. Keep an updated medication list. Write down everything you take: prescription medications, over-the-counter drugs, vitamins, supplements, even herbal products. Include the dose and how often you take it. Bring this list to every medical appointment. When doctors know everything you're taking, they can identify potential interactions and avoid prescribing something that conflicts. Use one pharmacy if possible. When all your prescriptions come from the same place, the pharmacist can screen for interactions. Pharmacists are medication experts, and they're often more accessible than doctors for quick questions. Use them as a resource. Schedule a medication review with your doctor at least annually. This is different from addressing acute problems. It's a dedicated conversation about whether everything you're taking still makes sense. Are there medications you started years ago that you might not need anymore? Are there newer options with fewer side effects? Has your health changed in ways that affect what medications are appropriate? Pay attention to how you feel. New fatigue, dizziness, changes in appetite, unusual swelling, mood changes. These can sometimes be medication side effects. Don't assume every change is just aging. Mention new symptoms to your doctor and ask whether any of your medications could be contributing. Never stop a prescription medication without talking to your doctor first. Some medications need to be tapered gradually. Some are preventing serious problems even if you don't feel their effects. If you're having side effects or concerns, that's absolutely worth discussing, but stopping suddenly can be dangerous. Be thoughtful about over-the-counter medications. Just because something doesn't require a prescription doesn't mean it's without risks or interactions. Read labels. Ask your pharmacist if it's safe with your other medications. When in doubt, check with your doctor. I also want to address something important: the relationship between you and your healthcare providers. The best medical care happens when there's trust and open communication. You should feel comfortable asking questions, expressing concerns, and participating in decisions. Good doctors welcome questions. They want you to understand your treatment and feel confident in it. If you feel dismissed or rushed, or if your concerns aren't being heard, that's a problem worth addressing, either by being more direct about what you need from the conversation, or by seeking a provider who's a better fit for you. Here are some ways to make medical appointments more productive. Write down your questions before the appointment. Bring that medication list we talked about. If you're discussing symptoms, note when they occur and what seems to trigger them. If you don't understand something, say so. Ask the doctor to explain it differently or write it down. And here's something many people don't realize. You can bring someone with you to appointments. A second set of ears can be invaluable, especially when discussing complex medical information. That person can help you remember what was said and can advocate for you if needed. Let me bring this all together. Medications are powerful tools that improve and extend lives. Most people benefit significantly from the medications they take. But like any powerful tool, they need to be used thoughtfully, with awareness of both their benefits and their limitations. As your body changes with age, your medication needs may change too. What worked perfectly at 60 might need adjustment at 75. Side effects you tolerated easily when you were younger might become more problematic, and medications that are absolutely essential for one person might not be necessary for another. This is why ongoing conversation with your healthcare team is so important. Not one-time decisions made years ago and never revisited, but regular check-ins about whether your treatment plan still serves you well. You're not powerless in this process. You're not just a passive recipient of medical care. You're an active participant with valuable knowledge about your own body, your symptoms, and your priorities. That knowledge, combined with your doctor's medical expertise, creates the best foundation for good care. Trust yourself to notice when something doesn't feel right. Trust your instinct to ask questions. And trust that being informed and engaged in your own care is one of the most important things you can do for your health. Take care of yourself. Your health is worth the attention, and you deserve medical care that truly serves your well-being.